I would like to move now to our next presenters, Dr. Ahmed and Dr. Sean Choi. Dr. Ahmed is the founding chair of the Department of Epidemiology and Biostatistics at the Robert Stemple College in Public Health and Social Work at Florida International University. He is also the founding president of the Council of Epidemiology Chairs and Directors and a four-time recipient of the American Association for Cancer Research and National Cancer Institute's Faculty Scholar in Cancer Research Award. His research in social epidemiology and intervention development is extensive. He's joined by Dr. Sean Choi, an assistant professor of economics here at FIU and a fellow of the Institute of Labor Economics and the Global Labor Organization. As an applied economist, Dr. Sean Choi has research interests in issues of global development with a focus on evidence-based policy research. He has also conducted extensive field research in South Asia and West Africa. They both will be presenting on the topic of using index-based decision-making for large-scale reopening during the COVID-19 pandemic, specifically presenting to the use and expansion of digital health. So for Dr. Sean Choi and Dr. Ahmed, I give you the floor.
Again, thank you so much for your generous introduction, Dr. Rusk. The Global Health Conference is a given opportunity, a platform where we can talk about the pandemic, how it's impacting us globally. If you recall, the initial epidemiologic models painted a terrifying picture, reflecting danger ahead of us. And if it is not contained, this coronavirus too could kill 50 million people worldwide. And you know, the making it is really deadliest virus in this century. And we all know about things like there is no proven pharmaceutical measures against this virus. So scientists, public health experts, and they're strongly advocating the government to implement public health interventions. Public health intervention to reduce human-to-human transmission of the virus by creating active social distancing, by closing schools, by banning public gathering, shutting down non-essential businesses, restricting travels, implementing lockdown measures such as shelter-in-place order. We have so many new terminology this pandemic brought to us. However, this intervention found to be very effective in reducing the spread of this coronavirus. And you heard this word many times, flattening the curve. And you will see in our results section how we are looking at the flattening the curve and making decisions. And despite of all, the coronavirus has created unparalleled catastrophes, causing almost 37 million cases and 1.1 million deaths globally. And it's counting every day going up. This public health measure has also resulted in a sizable disruption for the economy, triggering full food insecurity for the vulnerable population. And you have seen it, the long line of food pantry collecting the foods and unemployment benefit. And this situation is more alarming. It is more alarming for the resource-limited economy, where effective social security measures are not enough. And poverty is widespread. The large share of the population is living hand to mouth. So recently, the World Bank estimated that the coronavirus impact on the global economy, the growth will be contracted, reduced by 5%. and forcing an additional up to 100 million people into an extreme poverty. So given the consideration in the variation of the economy in health capacity across the country, especially low and middle income countries, now the only choice the government is doing, not really knowing what to do, when to stop, when to open it. So low and middle income governments are now balancing between the choice of saving lives or maintaining livelihoods. So these are the things going on, and countries are facing really mounting political and social pressure to fully reopen the economy or subsectors like school, tourism, sports, entertainment, and relaxing the adopting is called new normal. However, mature large scale opening too early could be do more harm than the good. And the probability of an immediate second, probably higher peak of disease resurgence. Now, question is, when to reopen? There is no guidance from WHO. Everybody is called lockdown, shelter-in-place order, but nobody is saying when to reopen. So, what we did not find any published directive or model to inform policy to reopen school, tourism, entertainment, and any other sectors. So in the beginning of this summer, when the coronavirus spreading really rapidly, we, FIU faculty, students, and graduates, create a group to help low-income countries in this historic phenomenon. In the meantime, Cambridge Oxford group led by Dr. Rajiv Chaudhuri, an expert on global health and epidemiology, published a model how to stop health system collapsing due to overload of coronavirus cases in hospitalizations. This is all received, and many media also really focus on those kind of things. However, their model helps to decide a periodic open and close to balance hospital resources. And their calculation based heavily on availability of health system data, ICU, emergency room, doctors, hospital beds, and many more detailed, refined information, which is not always available in resource-limited countries. Despite all, this model is very good and a good guide in a sense of, and help us to think further. If we don't have these refined data sets, all that we're looking for, when to start, we are thinking to develop a model for large-scale reopening. So what we did in our team member, Dr. Sajidul Talukdar, is an assistant professor of computer sciences in Edinburgh University, who has a keen interest in data exploration and big data set. With the help of Dr. Abir Rahman, a doctoral candidate of epidemiology, both of them really hunting for every country in the world, looking for data. But the refined data is not always available. So whatever data we have, the successful failure countries, we take care of all of those and combine them and find that, and Dr. Stiak, a FIU research faculty, who used the model and different way of looking at it, how to develop an index, a model to help policymakers to make a decision when to reopen the economy in a large scale. We then meet weekly basis, and finally we develop a straightforward index and a toolkit for large scale reopening decision making. So, and Dr. Sonchoy as you heard his profile, he is from the Department of Economics and Gate Foundation scholar. And for his research on migration and poverty and randomized control trial he has been inducted to MIT-led Poverty Action Lab group. Among this group, the members, there are many Nobel laureates, including last year's Nobel Prize winners in economics is Abhijit Banerjee and Esther Duflo. So Dr. Sanchoy will present the method and result and index and talk about this further. I will stand back and stand ready. Here is
Thank you.
Sanchoy.
Thank you very much for this kind introduction, Dr. Ahmed. Dr. Ahmed has already set the bedrock of this discussion. So pretty much, if we want to motivate our conversation, what is most important is we are asking the international agencies and all the public health experts are asking countries to lock down, but there is no clear indication that when it is safe to reopen the economy. So what we wanted to do is try to understand that those countries who have reopened, who has been successfully reopened. By successful, what we meant is these countries did not face any immediate resurgence in their COVID-19 caseloads. And after observing these countries' disease pattern and epidemiological pattern, we studied and we find some parameters for safe reopening. And then we went back to the original canonical SIR epidemiological model to see that whatever we have detected as a pattern, whether that pattern makes sense in that epidemiologic SIR model. And then when we found that is actually is quite valid, what we have found, we generated a toolkit. So this toolkit can be applicable for any country in the world, and it doesn't matter whether this is a resource poor country or a rich country. And from that toolkit, policymakers will get a straightforward decision-making pattern that, okay, if we see this is happening, then we will be able to reopen the economy safely. So could you please go to the next slide, please? Next slide. Thank you. So let me start with Germany. So Germany is a high-income country and also quite successful. So let me explain this data here. So this is daily new cases and daily new recovery data of Germany, and it's a 5-day moving average plot. So the red line is depicting the new cases, and the green line is new recoveries. So what we found that there is an interesting point, which is on the 5th April, the green line crosses the red line. So that means the number of recoveries in those days are higher than number of new cases. And this pattern continues. So just to give you some number, Germany imposed lockdown on the 17th of March. And then this crossover, this green and red crossover happened on the April 14th. And then Germany waited for another 20 days and just to see that if this pattern is consistent. So that if you look into this diagram, you can see that this recovery rate has been consistently higher than the daily new cases. And they waited for 20 days, and when they see that this is the pattern, they reopen. So in this description, and this is the words I will be using quite repeatedly, one is important factor is the crossover. The crossover is when your new recovery rate is higher than your daily new cases, and how many days a country is waiting after the crossover point. So in case of Germany, they waited 20 days and then they reopened. Next slide, please. With the same coin, we studied, say for example, Australia. Australia, you will see a similar pattern. The crossover happened on the 5th April, and they waited for 40 days. And then when they see that the recovery rate is consistently higher than the new cases, they reopen. And when they reopen, there is no immediate resurgence of the COVID cases. By the time they have reopened, this is pretty much the reproduction rate of the COVID is extremely low. So as a result, we don't see any immediate surge in the COVID cases. Now, one question could be asked that, okay, so this is the rich country data, so they have the means to lock down the country for a long time. What about poor countries or low-income countries? Because it could be devastating for their economy if they lock down for such a long time, because many people are working in the informal sector and they live hand to mouth, and it will be dangerous for them. And if they don't die with COVID, they might die with hunger. So we also looked into poor countries, that how they tackled the situation. So next slide, please. So by poor country, we look into low, medium income country. So in the next slide, we will see it. Next slide. So in the category of not high income countries, so we looked into low and middle income countries. So one example is Turkey. So you can see that Turkey is also a successful country according to our definition. And they waited for 16 days. So when they faced the crossover on the 5th April, and then they continue to see that if the pattern is persistent, and once they are confident, they reopen the economy, and they didn't see any immediate resurgence. Next slide, please. Now let's take it a country where they made it wrong. So this is the case of Iran. So in case of Iran, the crossover happened on the 8th April, but they rushed to reopen. So they didn't wait for 14 days or 15 days. So there was a pattern, but they reopened the economy on the 9th day of this pattern, and then immediately saw disease resurgence. So that Iran could have benefited from it if they waited like a few days more, but just because of this, the rush of not following this epidemiologic pattern, they reopened the economy quite. Next. Okay, so based on this pattern of data that we have found in the world in the early phase of lockdowns, and we try to detect this pattern, and we found there are three broader recipes for safe reopening. So number one is the crossover of daily infection and recovery rate. We call it IR crossover. The second is a minimum 2 weeks waiting period post crossover. So the countries need to observe at least 2 weeks of like a waiting period, just to see that if this pattern is consistent. And if they see that there is a consistent pattern, the recovery rate is higher than the daily case rate for 2 weeks, that probably can give them some confidence that this is now safe to reopen. Anything that you do before then could have the risk of having sudden jump in the cases. Next. So based on this definition, so the definition is there is no immediate resurgence in the caseload. There are available epidemiological data for many countries. I should mention here, and I think Professor Ahmed also mentioned, that there are other countries who also showed similar pattern of success, but we didn't get all the data required for our analysis. So it is based on those countries who have available data. And also we limited our analysis for those countries where at least they have 500 cases. So like there are some island economies who have really limited cases, and we didn't take that into account. And our main analysis is based on the initial lockdown wave that we have seen worldwide. So that is from 15th March to 15th April, most of the countries in the world went to the lockdown. So we focused on those countries. And based on that, we found 9 countries that belongs to high income group. And there are 7 countries who belong to the low income and middle income group. So that it is not only that the rich also belong to low and middle income countries. Next. So just to give you a summary statistics, kind of give you a sense of how much should be the waiting period. So the waiting period for high income country is more or less 24 days. For low and middle income countries, after the crossover of IR, they waited 14 days. So this is what we will be emphasizing, that there is a need for 2 weeks waiting period post crossover to have a safe reopening decision. Next. Now, based on this data, we went back to the SIR, canonical SIR model, and tend to give you a perspective. So on the upper panel, we have Germany, which is a successful country. In the lower panel, we have Iran. So in the Germany, and in the back of the data, so the purple line is the SIR plot, and the back of the line there are bar diagrams. That is the actual cases in both countries. And what you can see that the SIR model clearly shows that what will happen if you reopen early. So the Germany's case, the green line, the green curve is actual reopening. But had Germany reopened earlier, say an hypothetical point before the green line, they would have faced much more COVID cases and eventual deaths. But they waited for a considerable amount of time, and when they reopened, they didn't see much of the COVID cases. Whereas in the case of Iran, the actual date of reopening is the green line, and you can see that they face an immediate resurgence of the COVID cases. But had they waited for additional week, their COVID cases could have been much less. Next slide, please. So based on this analysis, what we have done is we created an index. So this index will give a straightforward decision-making tool for the governments or for the policymakers, and it can be applicable for the nationwide lockdown or for the zone-specific lockdown, that when it is safe to reopen. So there are 4 steps associated with this index. The first step is you need 4 daily data, and we can use 5-day moving average daily data. One is deaths per million. Another one is positive cases per million tests, then recovered cases per million, and new confirmed cases per million. These are my 4 main data that we need. Then once we have the data, the second step is creating a sub-index. So for each of these D, P, R, and C, we create a sub-index. So sub-index is kind of normalizing the maximum value and created an index that will give you a parameter. The third step, which is a sign index. So the sign index is created using the daily recovery rate minus daily new cases divided by the summation of these two. So what it will do, that it will create a sign. So positive means your daily recovery is higher than daily new cases, and negative means your daily recovery is lower than daily new cases. So that is clearly tells you it's not a good time to reopen. And in the fourth step, we have the arithmetic average of the sub-indexes multiplied by the multiplier. So the reason we use arithmetic average is if you have one variable missing, you can still estimate it. So that's the beauty of it, that we use arithmetic average, very simple, plain vanilla calculation to give an index. So now I will use this index and show the data with the index and how the index will look like. Next. So in these 3 diagrams, what we have done is we have the upper panel, which is the daily new cases and new recoveries. In the bottom panel, we have our index. So you can clearly see that there is a point when the index becomes positive, and this is when you have a crossover, and then the index remains positive for a considerable amount of time. So as long as your index is positive, that means you are actually in a favorable zone. And if you see there is a consistency of 2 weeks positive index, that means this country is ready for reopen. So we see the same thing for Australia, we see for Germany positive ER index, LSR index, and we see it for Turkey. Next. So we have all the successful countries. I'm rushing because I don't have much time. So we have all the successful high-income countries clubbed together, and you can see that by and large, the LSR index is positive when they reopened. Next. And we also looked into low and middle income countries, and I should point one thing here, which is for low and middle income countries, this LSR index is not always positive, but there is on an average, it is positive and showing positive trends. And the reason we see some fluctuation is largely contributing to the fact that they don't update the data regularly, and sometimes there are data anomalies, and that could have some fluctuations. So it could tell that the data needs to be much more accurate and they need to make regular updates. But if we plot this data for the low-income countries, we see similar pattern. It's not exactly one-to-one as high-income countries, but it's a similar pattern, positive trend and positive LSR index. Next. And now, just to give you a perspective for unsuccessful countries, if we plot this data, you will see that largely the LSR index is negative. So these countries reopened quite early, not at the same timing when what we are recommending. And as a result, they face a consequence. Whenever they reopen, they immediately saw a large jump in the COVID cases. Next, please. We also try to understand what are the external factors that will explain why some countries are successful and why some countries are not successful in terms of reopening. And what came quite strikingly in the principal component analysis is the governance matters. So those countries who have good governance and they have better implementation of the lockdown actually benefited a lot. What didn't matter much is the lockdown days. So it is not the days, number of days, that is not important. What we found is important is how stringently, how restrictively the lockdown has been imposed, so that the direct human-to-human contact can be reduced and we can create successful public health measures. Next slide, please, and that's my last slide. So just to sum up what we have done, we introduced a very easily interpretable large-scale reopening index, and this is based on validated with the data. So it is not that something we came up completely out of the blue. This is data-driven index that we have created, and we validated this data with the canonical SIR model, and also we have seen how this data behaves if we use it for the rich countries, poor countries, successful countries and unsuccessful countries. And what we found that basically countries need to wait when their daily recovery rate surpasses the daily new cases, and they need to wait for 2 weeks, and if they see this pattern is consistent, they can safely reopen. And the index will give you a very straightforward decision making. So they don't, country or policymakers do not need to understand the technical details of it. It will clearly shows positive and negative. If it is positive, that means it's good. If it is negative, that means it's bad. And we need to see positivity for 2 weeks time. And it will be extremely useful for the resource limited countries, not only for this pandemic, because the pandemic is not over. We might be imposing zoning lockdowns in the future, like some areas of the country will be locked down, and it can be implemented for that purpose. The second wave is coming. Epidemiologists and public health scholars are predicting a second wave, which will be the winter wave, so we can be well prepared about it, and we have all the data so that we can support this kind of decision making, and it will be extremely helpful for the future pandemics. So with that, I would like to finish this lecture. Thank you very much.
Thank you so much, Drs. Ahmed and Sean Choi, for that presentation. It was fascinating and such an important topic. And speaking for myself, I would love to get you both in front of Congress in the United States as quickly as possible. I'm particularly interested in our panel discussion, hoping that we can talk more about this index-based decision-making tool in other contexts. This seems to be such potential for translational research, and I'd be interested to hear how you think this might be applicable to developing smarter public policy in future pandemics. I know you touched on that a little bit at the end, but hopefully we can get some time during the panel to dive into that a bit more. So I'm hoping that we can move on to our next speaker, but Dr. Shadi Saleh